John Spencer, and welcome back to another episode of STEM Forward, the podcast where we dive into fascinating world of careers that shape the future.
And I'm Dr. Stephen Jones, and today we're going to talk about the rapidly growing field in healthcare. There's advanced practice registered nurses, APRNs. These include nurse anesthesiologists, nurse midwives, and nurse practitioners, and they're playing a bigger role than ever in providing high quality care. And this is a topic that I'm really excited about because I've been married to a nurse for 37 years. So I could talk about this forever.
Yeah, the role of the nurse has definitely changed from when we were younger till now. Before, it may not have been seen as maybe as vital, maybe because the way media portrays nurses, especially when we were growing up and watching TV. But absolutely, Steve, whether you're managing anesthesia during surgery, delivering babies, providing primary care, specialized care, APRNs are at the forefront of the modern healthcare. And what's exciting is that the demand is skyrocketing. I think about, I have a very close friend. Their father was a general practitioner, was an MD. And one of my other mentors was an MD. Well, actually, he was a DO, doctor of osteopathic medicine. But they were both private practice general practitioners. And they had great practices, made a great living. But 30, 40 years later, a lot of that primary practice in general medicine is taken care of by nurse practitioners. Most of the times when I go for a regular visit, most times I do see my doctor, MD, but a lot of times maybe for a sick visit or something like that, I'm seeing a nurse practitioner. So that's a definite change from when we were younger.
Yeah, I think that just trying to keep up with all of us who are the baby boomers is a challenge. I'm right in that group. So It's really important to have as many options as possible. There's urgent care, of course. Now you can go there rather than wait in an emergency room and get service there as well. So you need these additional levels of trained professionals to get involved with this. So I'm happy to see that this is happening. And the job outlook projected to grow by 40% from 2023 to 2033. And I was just thinking about the fact that we've also lost a lot of nurses through COVID. And so that's created an even higher demand. Some nurses were so overwhelmed by it that they backed out of nursing during that time, which opened up other opportunities for individuals to take advantage of the whole healthcare system. So go ahead.
No, go ahead. Finish your thought.
No, I just say this is really rewarding and it's high demand. It breaks down into 3 different segments. With APRNs do how to become one, and the job outlook and the pay is really important to take a look at.
But just like you said, you have the baby boomers that are aging. Generation X is right behind them. This makes me think about how some corporations had to change how they were doing business. I can't remember if it was the late 90s or early 2000s when CVS said that they were no longer going to sell any more tobacco products, and because they were a healthcare company. And now CVS, they're all over the place, and they have their minute clinics. And a lot of the people that are manning the minute clinics doing the vaccinations and different things are either pharmacists or nurse practitioners. So it's definitely in demand. So don't forget to tell people to subscribe to STEM Forward and share this episode with someone that's considering a healthcare career. So let's jump into it, Steve. So what do APRNs do?
Let's start with the nurse, anesthesiologists, midwives, and practitioners. They do. These healthcare professionals play a crucial role in patient care. They may provide primary or specialty health care, but the specifics of their duties vary according to just where they're placed in the whole healthcare system. One of the things I will just say, I just became a great uncle. So in terms of anesthesiologists, that was important even in my niece's care and delivery. So I know that those people are important.
Yeah, I know in talking to my wife, and she's always kept me very aware. Maternal health, that they don't call the miracle of life giving birth to babies that for nothing.
Mhm.
Um, Wife and infant mortality is still an issue. So you have a lot of women that are turning to midwives to have more personalized care, to try to make sure that they have a good um, birthing experience. So yeah, that's right, Steve. Nurse practitioners, CRNAs, administer anesthesia to patients undergoing surgery. They monitor vital signs throughout the procedure, adjust the anesthesia levels, and handling pain management and some emergency services.
Wow, that's a critical job that takes a lot of detail in this job as well as I look at and sometimes there are situations where there are surgeries that are emergency surgeries. So they have to
Hmm.
be, really prepared to do the anesthesiology.
Hmm.
Uh, their nurses and midwives are seeing MS. Women's health care is important about that. They provide gynecological exams, prenatal care, and even deliver babies. They also help manage emergencies during labor and delivery and provide post delivery care.
Right. So it's when you think about TV shows, I remember growing up watching Saint Elsewhere, or as I was older, ER, and even Grey's Anatomy. You saw the nurses that they were in the background, maybe at the nurses station, but they didn't really show the vital role that somebody like a nurse practitioner, um, in those kind of mainstream television shows.
Mhm.
But nurse practitioners, can act as a primary and specialized care provider. They can diagnose and treat conditions. They can prescribe medications. They can order tests. Many nurse practitioners work in specialized areas like pediatrics, geriatrics, mental health, focusing on improving patient outcomes throughout preventive care and treatment plans. So, like, one of the things, you can have a nurse practitioner with a psychiatric specialty. Like, you can't necessarily see a
Mhm.
psychiatrist. You can see a nurse
That's
practitioner with a
interesting.
psychiatric
Mhm.
um, specialty.
Mhm. Yeah, and you can develop that specialty. Sometimes you fall into it. You don't go like directly into it, but you're having conversations and you find that there's another venue within healthcare. And that's the
Hmm.
one thing I will say also. You can explore all the options and not feel stuck just because you came in as a nurse. But I always say this, and I've always said this to my wife, thank you, because you are the ones who really keep the patients alive. You know what's
Hmm.
going on with them. You know what medications they're taking. You know what their blood pressure is. So the doctor comes in, and you're one of the people that they're going to ask questions to. So you are a vital person in that. Um, and despite the nurse's role, a lot of it is specialized. For instance, a nurse practitioners might consult with physicians for complex cases, while nurse anesthesiologists are exclusively involved with anesthesiology and periperative care. Nurse midwives play a unique role in maternity and reproductive care.
You know, they have one thing in common, though, as nurses, Steve. They aim to deliver patient centered care. That means they understand the patient, like how you were just saying. You know, they're the ones that are there day to day with the patients while they're getting treatment, understanding their needs, their lifestyle, and ensure the best treatment options. While they often work independently, many of them collaborate closely with doctors, like you were saying, and other healthcare professionals to make sure that the patient gets the optimal care.
Yeah, it's really fascinating area of healthcare. And if you're interested in making a real impact in the lives of people, become an APRN. It's something that really you should consider.
Mhm. And for those of you who are enjoying this episode, don't forget to subscribe to STEM Forward, share with your friends and family who might be interested in this rewarding career. We will be right back after a short commercial break.
Do you want your students to earn excellent grades? This is Dr. Stephen Jones, author of 7 Secrets of How to Study, the nationally recognized book, and my online course. The students in your organization can earn A+ grades in just a few hours. Get the 7 Secrets of How to Study course for your students. You won't regret it. Well, welcome back. Now let's talk about how to become an advanced practice registered nurse. The road to becoming an APRN is more involved than other nurses, but the rewards are substantial. I mean, there's so much opportunity. I'm a person that loves more education. So this is going to require a little more education, but it'll be worth it in the end. And I think a lot of the APRNs would tell you that the journey was not as easy as they would have liked for it to be, but the rewards afterward and the ability to do certain things within the field is substantial.
And one thing I want people to understand, I have a K to 12 background as a school leader. When you hear your child say, I'm interested in being a nurse or I'm interested in some sort of healthcare profession, that's something that you have to nurture. One thing about these programs, they are very competitive, and you have to have good grades in math and science, good communication skills, and things of that nature. Because even to get into a nursing program at the community college level after high school, you have to have a good GPA to meet the minimum requirements. So, Steve and I are talking about a more advanced stage where, yes, you do need a master's degree in a chosen specialty, whether it's anesthesia, midwifery, or advanced practical nursing. But before that, you have to become a licensed RN, and that journey starts whether it's in community college or at a 4-year college. But you have to make sure in high school that you put yourself in a position to get into one of these highly competitive programs. Because like Steve said earlier, the growth rate is 40% over the next decade. But you have to be qualified to make sure that you even can take advantage of this opportunity.
Well, I tell people to look at it this way. Would you want a doctor or a nurse that only had C grades while they were in college? So they want them to have the highest grades possible because they're taking care of all of us. And that's one of the elements of passing this licensing exam. It's not an easy exam. Some nurses take a whole course in getting ready for the exam that they had to take. So, and then that exam ensures that you're licensed, but there's continuing education that has to happen even after you have a license. So that keeps the nurses aware of new changes that are going on. But completing a nursing program and passing the NCLEX RN exam and gaining experience as an RN, for example, to become a nurse anesthesiologist, you need at least a year of experience in a critical care setting before applying to be a nurse anesthesiologist. And these programs, they're all around the country, but I'm sure that they're not easy to get into. So you want to be the best nurse that you possibly can be.
Yeah, I definitely do not want somebody with gentleman C's uh, working on me and providing me care. I want somebody that was towards the top of the class, um, helping me out. But you're
Hmm.
right, Steve. Most APRNs hold master's degrees. Some may even pursue further education, like a doctorate of nurse practitioning or a PhD, depending on your career goals, because that's adding more time in terms of school. Those advanced programs cover health assessment, pharmacology, pathopsychology, um, and other clinical experiences. So depending on how far you want to go, there's a lot of opportunity and a lot of educational advancement that you can pursue within this field.
Yeah, John, I have to open up a dictionary to understand all these different titles and positions. It's, pathophysiology. So I will encourage anyone that's listening just to dig in and find out more about these opportunities.
Yeah, you definitely have to know your Latin roots and different things, because sometimes we murder some of these words.
Yes, yes. Help us. After completing your education, you must pass a national certification exam specific to your role, whether nurse anesthesiologists, or nurse midwives, or nurse practitioners, and then you apply for a state licensure. So, yeah, there are people even that's an opportunity too to be on the board that licenses nurses.
Mhm. So one thing you also have to understand: just because you get your license doesn't stop there. You have to maintain your license through your certification through continuing education and periodic recertification. Whether you administer anesthesiology or anesthesia or guiding a mother through childbirth, you need to stay up to date on all the latest techniques. I do not want somebody that just finished school, finished school 30 years ago and has not taken any continuing education or had their certification redone, working on me either. I need somebody that's up to date on the latest techniques, providing me healthcare.
And with all these, the new thing is robotics and
Hmm.
robotic surgery. So that's a
Hmm.
whole nother level. We'll have to do a session on that robotic surgery and
Hmm.
think about
Hmm.
it because there's all kinds of engineering involved with that mechanical, civil. I mean,
Hmm.
mechanical. Uh, there's the chemical side of it. There's the electrical and the computer side of these robots that actually do surgery. And I'm sure
Hmm.
that some of these people we're talking about today are in the room when these
Hmm.
surgeries are going on.
Hmm.
So, this is a challenging path. The opportunities are incredible. Plus, there's a growing need. I think we said 40%. That's just crazy. And we'll see in the next segment, the job outlook is continuing to grow.
Hmm. So that's right. If you want to become an APRN, research accredited programs, that means programs that are recognized by a governing body that says that their program is top notch. Um, Look at their certification requirements, so you can understand, what prerequisite course and other education that you have to get in there. We're about to take another break. Don't forget to subscribe to STEM Forward. Share this episode with friends so they can learn about this exciting career path. Um, and we'll be back after another break. Are you a solo entrepreneur, entrepreneur, or small business owner looking to establish a strong online presence? At Teach It Labs, we specialize in creating mobile-friendly websites tailored just for you. Our customizable templates are easy to showcase your brand without any coding experience. Plus, with our learning management systems hosting, delivering educational content online has never been simpler. Ready to elevate your business? Visit teachitlabs.com and let's build your digital future together.
Well, welcome back to STEM Forward, and we want to take a look at the job outlook and pay for nurse anesthesiologists, nurse midwives, and nurse practitioners. As we mentioned earlier, the demand for APRNs is growing rapidly, and this field is expected to grow by 40% from 2023 to 2033. And that's much faster than the average for all occupations. Again, if I work at Villanova University, and we do have a nurse department there, and our nurses are in high demand. Every one of them get a job coming out, and they go into different aspects of the field. And I will say that they also are required to do internships in hospitals as part of the process. So you'll even get an idea of the potential because while you're in college, you'll be learning and you'll be in hospitals practicing at the same time.
Yeah, that growth rate is, that's big. But like we said earlier, because of the aging baby boomer population, Gen X right behind them, there's definitely an increased focus on preventive care. And that's a sweet spot for APRNs. And they play a more vital role in that part of the healthcare system. So that's about 31,900 job openings projected each year over the next decade. Think about it, 31,000 jobs across the country each year over the next decade. So that's roughly 310,000 nurses, advanced practicing nurses that will be needed over the next decade.
Yeah. And that's in all different kinds of communities, whether we're talking about the large cities or urban or rural, all across the country. They're big needs. So it's not a shabby place to get started. And a median or annual wage for nurse anesthesiologists, nurse midwives, and nurse practitioners from 2023 was $129,480. And nurse anesthesiologists, however, even earn a higher median salary of 212,650. I think you could live off of that.
And one thing, we have to remind our viewers, once you have the license, once you have the certification, it travels. So you are not just locked into one part of the country. Yeah, yes, the salary may change, but 9 times out of 10, you're going to have a higher salary than most of the people that you are in community with. Nurse midwives, nurse practitioners, have a median annual salary of 129,000 and 126,000 respectively. These figures do depend on industry, location. For instance, outpatient care centers and hospitals pay more than physician offices or educational services.
And the pay is competitive, especially considering the minimal upfront education and training requirements compared to other medical professions. Physicians pay hundreds of thousands of dollars more to get there, and they stay in the process longer. And with the field growing rapidly, it's an excellent time to pursue this career. I want to encourage everyone out there that this is something that you can do, and there are definitely role models and mentors out there who would love to have you, learn from them.
So if you're considering a healthcare career, consider one of these roles. You can definitely rest assured that there'll be job security. The pay is going to be excellent. And you're going to make a significant difference in people's lives. So just sure, that you are prepared for a demanding work environment. Like Steve said a little bit that, comparatively speaking to some other medical professions, this is still demanding in between the education workload and certification, but also the actual job is demanding. So the reward and the work, kind of go hand in hand. You make those good salaries because of the demands of the work.
That's right, John. The work can be physically and emotionally demanding and incredibly rewarding. And as healthcare goes, there are many different types of models. APRNs will be even more essential in delivering patient care as the technology continues to impact what happens with nurses and physicians in the hospital. There'll be different ways that they get involved in serving in these roles.
Yeah, we've covered a lot tonight, Steve. This is definitely a rewarding career that we would hope that some of our viewers would be interested in or share or share with a young person or somebody that's maybe changing careers and things like that, because this is a definite need. So if you liked this episode and you enjoy us talking about these various topics, make sure you subscribe to STEM Forward, share this podcast with other people, and thanks for listening.
Awesome. And we will see you the next time. And we have a lot of wonderful information that we want to present so that we can encourage more individuals to get into STEM. And I just want to say that we know the traditional college age 18 to 24-year-olds go into these professions, but some people who are older decide to change their career, and the healthcare is the direction that they get involved in. So hopefully this is helpful. Keep pushing forward.
All right. I'm Dr. John Spencer.
And I'm Dr. Stephen Jones. Thank you for coming today.
Thank you for tuning in to STEM Forward. For more information about this episode, visit our website and check out the show notes.